Hi, I'm Anna with Freedom Weight Loss Clinic, and today I'm going to discuss some of the most frequently asked questions regarding semaglutide, one of the more popular weight loss drugs that we offer at our clinic. If you want to reach out, schedule an appointment, or contact us, have any questions, you can go online to freedomwlc.com, or you can contact us via phone or text at 225-335-8541. Yes, semaglutide was FDA approved for chronic weight management in June of 2021. So Ozempic and semaglutide are exactly the same medication. Wegovy and semaglutide are exactly the same medication. Semaglutide and Mounjaro are in the same class of medications, but they're not exactly the same. Semaglutide works as a GLP-1 receptor agonist, whereas the Mounjaro, or generic tirzepatide, it affects both it's a GLP-1 receptor agonist and also a GIP receptor. It works on two receptors, whereas semaglutide works on one to promote weight loss. So GLP-1 is a hormone that is released in the gut in response to food intake. It activates areas in the body such as the gut, the liver, and the pancreas, and the resulting effect promotes weight loss. Semaglutide helps us lose weight by firstly acting on the gut to slow gastric emptying so we feel full faster. And then it acts on the pancreas to increase glucose-dependent insulin production. And then the liver reduces glucagon production after we eat. This combination results in decreased hunger, early satiety, and increased energy levels, which help to promote weight loss. With semaglutide, you can expect your appetite to be decreased, you to feel full faster, thus eat less. You can expect to stay full longer, and you can expect decreased cravings for energy-dense foods such as sugars, and an improvement in appetite control. So semaglutide is not for patients who have a history of pancreatitis, personal history of thyroid cancer, a family history of medullary thyroid cancer, or multiple endocrine neoplasm type 1 or 2, and those patients who are diabetics and already on anti-hyperglycemic or anti-diabetic meds that lower your blood sugar. Additionally, women who are breastfeeding, pregnant, or planning on becoming pregnant should not take semaglutide. Some of the most common side effects with semaglutide are nausea and constipation. Additional side effects include indigestion or heartburn, abdominal cramping, diarrhea, and dehydration. Some of the less common side effects include fatigue and headaches. Yes, absolutely. There's a number of things we can do to help to reduce potential side effects with semaglutide. For the nausea, we can take over-the-counter Dramamine. We can also call in a prescription for anti-nausea medications such as Sofran or ondansetron. It's a tablet, goes underneath the tongue, it dissolves, and we can call it into the pharmacy of your choice. For indigestion or heartburn, there's some over-the-counter medications we can take such as Tums, Pepcid, or Prilosec. If we're having constipation, fluids and fiber are going to be important to promote soft, regular bowel movements. Additionally, if we're prone to constipation or having trouble, we can also take a daily stool softener such as Colace or even a Miralax daily. For diarrhea, it's important to replace fluids lost. If the diarrhea is moderate to severe or negatively affecting your daily life, we can use some over-the-counter medications such as Imodium or loperamide. Additionally, for dehydration, again, it's important to replace fluids lost. If you're a woman, we should be drinking approximately 91 ounces or 2.7 liters of water per day. For men, that's 3.7 liters and 125 ounces per day. If you're exercising frequently, you do want to add at least 12 ounces of water for every 30 minutes of moderate physical activity. Fried foods, fatty foods, and foods high in sugar tend to be tougher for our body to digest and will increase nausea. The sugary beverages such as wine and mixed drinks will definitely cause nausea or increase the potential for nausea, as well as the carbohydrates and starches. They can increase nausea, indigestion, and heartburn. In addition to promoting weight loss and helping you feel full, water helps to prevent constipation. It aids in flushing out the kidneys to prevent an acute kidney injury. And in women who are more likely to experience urinary tract infections, it helps to flush out that excess sugar and prevent urinary tract infections. No, not at all. There's no specific diet. There's no calorie, carb, macro, or point counting required. Eat what you want, when you want, and still lose weight. although a healthy diet only helps to promote weight loss. It may take up to 2 to 3 weeks to see results. However, most patients report results after 7 days of the medication. So every patient's different, but published studies show an initial weight loss of 10 to 15% of your body weight. For example, if you weigh 200 pounds, you could potentially lose 20 to 30 pounds. However, a lot of patients lose much more. In a trial comparing semaglutide and tirzepatide, each administered once weekly by subcutaneous injection or into the fatty tissue, average reduction in body weight was greater with tirzepatide. Study participants taking 5, 10, and 15 milligrams of tirzepatide lost on average 4 to 12 pounds more than study participants taking 1 milligram of semaglutide. However, it is important to note that semaglutide doses can be increased up to 2 to 2.4 milligrams for weight loss. Initially, you may not identify that your body is not hungry and continue to eat the same amount of food out of habit. For best results, eat when hungry and stop when full. Also, if you reach a plateau, you don't necessarily need to increase the dose. Instead, minimally increase your activity level, such as increasing your daily steps, taking brisk walks around the neighborhood. Moderate activity or exercise helps to promote weight loss effects. So here at Freedom Weight Loss Clinic, we offer generic semaglutide and tirzepatide in compounded form in a vial in which you fill up the medication yourself. The other branded medications, such as Ozempic, Wegovy, and Mounjaro, are trademarked for the pen-click delivery system or single-dose pen. That's why we can get it cheaper. Both semaglutide and tirzepatide are once-weekly injectables. Best part, you don't have to remember to take it every day. It doesn't matter if you ate or didn't eat before you administer your injection, and it doesn't matter if you choose to do it morning, evening, or nighttime. As long as it's administered the same time every week, we're good. You will drop the medication using a very fine insulin needle and inject it into the subcutaneous tissue, the fatty tissue, in the back of the arm, the belly, or the thigh. Studies show the medication is safe to use long term. Once we reach our goal weight, we will cut your dose in half and continue that every week. As long as we're maintaining, we can extend the time between doses to once every 10 to 14 days. If you choose to stop taking the medication, that's completely fine. However, you still need to be disciplined in controlling cravings and hunger. As with diet, exercise, and even bariatric surgery, if we revert back to those unhealthy eating habits or become sedentary, it is possible to gain the weight back. Absolutely not. Stay on the medication as long as you want. Stop taking it whenever you want.